The heart sets the force and the speed of each push. If it beats harder or faster, the pressure rises. If it beats more efficiently, pressure falls. But at the end of the day, the heart is just responding. There are other organs at play here. The actual vessels themselves can expand and contract, which controls the blood pressure that the heart has to pump against. And this can be controlled with nitric oxide. This is controlled with the hormones. This is controlled by nervous system inputs. This is controlled by inflammation. These all contribute to what is called smooth muscle that lines these vessels. And that smooth muscle is what helps you expand and contract the size of those vessels. And this controls the pressure, which controls how much your heart has to pump against to create enough pressure for there to be circulation in the first place. This expansion and contraction of your blood vessels with the smooth muscle is called vessel tone. It's like muscle tone. If you are really contracting your muscle hard, you see yourself as more toned, right? Your vessels are kind of doing the same thing in order to expand and contract your arteries. This matters because the diastolic pressure, that bottom number, is largely determined by this vessel tone. If it has problems relaxing, this causes higher diastolic pressure. So things such as your A1C that glycate those vessels and make them stiffer and harder to relax can raise that. So that's why we need to keep A1C down in addition to all the other things that A1C causes. The kidneys and the adrenals, we have to talk about both of them. They both directly contribute to your blood pressure. Everybody knows what the kidneys look like. The adrenals are a little tiny organ. Well, they're not tiny, but they sit right on top of your kidney. They look like fat, but they are actually an organ. The kidneys, what they do is they decide how much water your body keeps. And this is going to contribute to the amount of pressure that your body feels in its circulatory system. You're going to pee out what you don't need. The second thing it does, there is renin and angiotensin. These are two hormones that are released by the kidneys that directly control blood pressure. Okay, your kidney releases this in order to determine how much pressure it's going to be receiving based on what's going on in the overall environment. Okay, so this can control your blood pressure as well. The adrenals, they have a hormone called aldosterone, and aldosterone also controls the amount of salt that your body is keeping. Okay, and this salt tells the water, or tells how much water gets to stay in the body. Aldosterone controls that and therefore controls your blood pressure. The adrenals, they also release cortisol. They also release adrenaline. These have direct and instantaneous effects on your blood pressure, on your vessel tone. Long story short, your blood pressure and your kidney health are inseparable. And we don't want to make this job harder for your body. As you can see, this is a very complex system of things that are happening all at once to make that blood pressure be just enough so that you are compatible with life. So we don't want to make this